welcome back to ABA Exam Review and the continuation of our BCBA exam practice questions series, where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack and practice exams. As always, when you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Monique is putting together a puzzle with her older sister. Each time Monique finds a puzzle piece, her sister says nice job and gives her a hug. Monique loves to do puzzles with her sister and is always asking her sister to do puzzles with her. What type of reinforcement schedule is Monique likely on relative to finding pieces? All right, so we have a reinforcement schedule question, a pretty basic reinforcement schedule question in more ways than one. It's pretty easy, and we're talking basic schedules here. And we're looking at Monique's behavior. So that's very important because we have Monique and her sister. Additionally, Monique is engaging in a couple different behaviors. She's looking for pieces. She's putting puzzles together. She's asking her sister to do puzzles. So what is the question specifically asking about? Well, the question is specifically asking about Monique's behavior relative to finding pieces. And so you can see how questions can be made more difficult by giving more information, right? Because really, this is not a difficult question, but we've got two people and then several different behaviors. You really have to focus in on what the question is asking about. So Monique's behavior of finding pieces, what type of reinforcement schedule is that on? Well, we know each time Monique finds a piece, what happens? Well, her sister says nice job and gives her a hug. So if every single time Monique engages in the finding the puzzle piece behavior, she receives a nice job and a hug, what type of schedule is that likely representing? A, CRF. And people ask, do I need to know the acronyms? You do. Unfortunately, you do. We work in acronyms. We know acronyms. We use acronyms. You've got to know acronyms. CRF stands for continuous reinforcement. So this is a continuous reinforcement schedule. And on a continuous reinforcement schedule, every response is reinforced. Now, the only basic schedule that is continuous is B, FR1, a fixed ratio 1. The response gets reinforcement. C, a variable ratio 1, is on average, every response receives reinforcement. Monique's behavior is not receiving reinforcement on an average. She's getting a hug and a nice job every single time. So what type of schedule is Monique on? Well, she's on a continuous schedule and an FR1 schedule because they're the same exact thing. So Monique is on both A and B, a continuous schedule, or in other words, a fixed ratio 1 schedule. Dr. Smith recently conducted a study to determine the effectiveness of functional communication training when used with koala bears. Dr. Smith's findings were replicated several times across different species of koala bears. What is Dr. Smith practicing specifically? This keyword specifically, we always are looking for the best answer, of course, but when they give you words like specifically, or when they tell you pick the best answer, you really, really want to hone in and be specific. So we're looking at Dr. Smith and what he's practicing. Well, he conducted studies on FCT, or functional communication, with koala bears. When are we studying animals, or who studies animals, or what branch of behaviorism, if you want to refer to it that way, do we study animals? Let's take a look. A, behaviorism. When we talk about behaviorism, we're talking about the overall philosophy and theories that guide behavior science. Behaviorism is kind of the overarching idea of our behavioral science. We're looking for something much more specific here for what Dr. Smith is practicing. And really, the only options you should choose between are B and C, experimental analysis of behavior and applied behavior analysis, because D, practice guided by behavior analysis, is when we're actually implementing services. Think about what registered behavior technicians do. They are using, or they are engaging in, practice guided by behavior analysis. B and C are going to be the more research focused. And applied behavior analysis, which we do, is when we basically study human behavior. We introduce independent variables. We study dependent variables, usually in a one-on-one setting, but it's still applied research, more or less. Dr. Smith, however, is looking at koala bears. He's not taking the science and applying them to human, socially valid, meaningful behaviors. He's looking at animals. In that case, Dr. Smith is really practicing an experimental analysis of behavior. Now, from experimental analysis of behavior, which Skinner did with his pigeons, we go to applied behavior analysis and we start applying these ideas and concepts to humans. And from those results, we can go to practice. And so you can see kind of the chain. And you don't have to have experimental analysis of behavior before ABA, but it's a good way to think about it. Behaviorism is the umbrella. Experimental analysis of behavior is these controlled laboratory settings, typically with animals. We then take those results and we apply them to human behavior in the natural environment with applied behavior analysis. And then we take those results and we put them in practice, which is what we do when we serve clients. So what is Dr. Smith practicing specifically? Well, experimental analysis of behavior. Your client is plagued by social anxiety, but you finally convince them to join in during peer play outside. After about 10 minutes of play, your client tells you that their stomach hurts and that they would rather just sit inside. Now, whenever peer play is available, the client gets a stomach ache. Parents tell you that the client is faking and want you to push them to play with peers. What should you do? This is a tricky situation because immediately as analysts, we start to tend to agree with the parents, right? You see that your client has social anxiety, and as soon as they're playing with peers, all of a sudden their stomach hurts. They want to sit inside. Now, every single time peer play is available, they get this mysterious stomach ache. As RBTs, as behavior analysts, we're immediately like, all right, this looks like escape. Even the parents are saying, well, look, they're faking, push them to play. However, what do you need to do first? You know they have social anxiety, and that might not be a behavior analytic term, but if they have it, they have it, right? We don't discredit other fields of psychology and science. Let's say they do have social anxiety. What if the stomach ache is real? Now, given the information, who knows? But there's something we've got to do with medical-based issues before we intervene. So what should we do in this case? A, conduct an FBA and write a behavior plan. Before we get to that point, we've got to verify this stomach ache. Is it real? Is it not? B, learn more about social anxiety interventions. You can. It might not be the worst thing in the world. Maybe take a CE, maybe go to a conference. Learning about things outside of our field is a very good idea because most of your clients are going to be dealing with things that aren't necessarily ABA specific. However, that's not going to help in this particular case because we're not going to deal with the anxiety. We need to look at this idea of the environment of peer play leading to the stomach ache and avoidance. Why is that? C, recommend the parents take the client to the doctor first. Yes, this is what you want to do. You have to rule out that these stomach aches aren't real before we start assuming they're not real. Now, does that add extra work, extra time? Of course. You've got to do it. We always rule out medical variables first, no matter what. D, prevent the client from escaping peer play. Before we do any of these things, the first thing we need to do is rule out that these stomach aches may or may not be real. So get them to the doctor. You could also view it as you get them to whoever diagnosed their anxiety, the social anxiety. Maybe they have some feedback. But if it doesn't look necessarily like it's strictly a behavioral thing, it's a stomach ache, which is an ailment, and he's got this dual diagnosis of social anxiety, we've got to figure out those things first. And then, in collaboration, we can start approaching things in a behavior analytic fashion. So this is all part of being a behavior analysis. There's more to the job than just writing behavior plans and skill acquisition plans. You receive an email from your boss that says, send me those updated TPS reports by Wednesday. You respond with, on it, I will have them to you soon. What type of operant describes your boss's behavior? All right, we've got some verbal operants here. So we're looking at whose behavior, because with verbal operants, we're going to have a listener and a speaker, and then you become the speaker, right? So in this case, initially, you're the listener because your boss says, send me those TPS reports by Wednesday. Remember, verbal behavior doesn't necessarily need to be spoken. Verbal and vocal are different ideas. Verbal behavior can be written, it can be signed, it can be pictures. In this case, it's the email. So your boss says to you, send me those reports. You say, on it, I will have them to you soon. We're looking at the boss's behavior. What has your boss done? Well, your boss has made a request. Get me those reports. Your boss has demanded. You respond with, on it, I will have them to you soon. What is your behavior? Your behavior is an interverbal. This is how they're going to try to maybe trick you on the exam, is they're going to put multiple listeners, multiple speakers, multiple responses, and then they're going to be very specific about who we're talking about. We're looking at the boss. The boss says, send me those TPS reports. That's a request. Your boss mandated for those reports. If they said, what is your behavior is an interverbal. Behavior technician that you supervise works in a school. This technician floats in between rooms and works with a few different children. One day, the technician is asked to act as a substitute teacher on Friday, as another teacher will be gone that day. What should you advise the behavior technician to do? All right, so you're giving guidance to your supervisee. Remember, if you're supervising somebody, you're responsible for everything they do. Is it always fair? Nope. But that's the responsibility you accept when you agree to supervise. So if you have a technician that you supervise who's working in a school, they're your responsibility. That technician floats in between rooms, working with different children. One day, they're asked to act as a substitute teacher on Friday because another teacher is going to be gone. What should you tell them to do in response to this request? A, act as the substitute since the school made the request. Now remember, you and the technician both abide by our ethics code. Ethics code says we only engage and participate in things that we're competent and trained in. The technician is trained in ABA. They're trained with those children, the few children they work with. However, are they trained as a substitute? That's what matters here. B, only acts as a substitute if she is qualified and competent. Sure, if she's qualified and competent, she can act as a substitute. What about C, refuse, as this would create a dual relationship? Now, this one's tricky. It's not going to create a personal relationship because she'd still be there in a professional capacity, but there is maybe a chance that she could be substituting for the children she works with. However, it doesn't say that. Nowhere in the question does it say that. All we know is she works with a few different children in the school. So we can't assume that. So C is not as strong as B because B is factual. Only act as a substitute if she is qualified and competent. C says it's going to create a dual relationship, and it might not. So B is stronger than C. And then D reports a school to the Behavior Certification Board for ethics violations. Remember, only people certified by the board follow our ethics code. The ethics code does not apply to people outside our field. Don't make that mistake. Is it a great ethics code? It really is. I honestly can say it's a great ethics code. But the only people who need to follow it or are supposed to follow it are us, people certified by the board. The school does not have to abide by our ethics. You, however, do. So you need to tell the technician they should only act as a substitute if she is qualified and competent. You, a behavior analyst, ask a behavior technician to use a whole interval measurement system to track social engagement for one of your clients. After defining the behavior, the interval is set at 15 seconds. What is the requirement for the technician to record a response in this scenario? All right, requirement for the technician to record a response. Well, what are we tracking? What are we using to track? Start asking yourselves questions. Okay, so we have a behavior technician. They're using whole interval measurement. So with whole interval measurement, we're going to set an interval. The behavior has to happen that entire time. We're tracking social engagement, and our interval is set at 15 seconds. So to get a response, that behavior has to happen the whole interval, which is 15 seconds. So A, record a response whenever the client is engaged socially. It's not true. That's not how this interval measurement works. It has to occur the whole time. B, record a response if the client engages socially at any point during the interval. That would be partial interval. C, record a response if the client engages socially for the entire interval. There we go. There's our whole interval measurement. C is good. D, record a response if the client engages socially at the end of the interval. That is momentary time sampling. The right answer here is C, record a response if the client engages socially for the entire interval. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. Please subscribe if you haven't already. Let us know when you pass. Work hard, study hard, spread the word, and we'll see you soon.